When you go buy a new car, you don't let the salesperson tell you which car is best for you. So how can you, as a patient, take control of your health care and become an informed consumer?
First and foremost, it's to make the most of the time that you do have with a doctor or whatever provider you're going to see, and recognize the fact that they're going a million miles an hour, and you have to go in and get them to slow down enough to personalize that diagnosis for you or your family member individually.
For Trucks Dole, navigating the healthcare system is a full-time job. He works for Regence, helping make it easier for patients to make informed decisions about their medical care. Ironically, as the parent of a son who's had 3 different cancer occurrences, he also has first-hand knowledge of what patients need to find their way through the intimidating maze of healthcare and what they need to get the most as a consumer.
The comment that struck most home to me is one of the docs said, "It's your care. It's your health. Why would you not be the one managing this?"
To maximize your particular visit, it's great to have an agenda. Understand what it is that you want to get done and come with as much information as possible.
Patients should be very proactive. They should have a list of questions that they're interested in having answered.
So why do I need the C-reactive protein test again?
The other thing they need to understand is they are actually partners in their care, and it's important that they take that responsibility. Because while the clinician may be an expert about the diagnosis or the health condition, or even interventions to improve the health condition, they are not experts on the patient.
For most people, a visit to the doctor can be pretty routine. But over a lifetime, consumers will most likely have to deal more frequently with health problems for themselves or a family member.
Everybody is 1 degree of separation away from somebody with a significant health need in this country.
Any diagnosis can potentially be a serious diagnosis to you and how it affects your life. Don't be afraid. Don't be stoic. Don't feel as though there's one right way to handle any sort of news. We're all different and we need to handle it in our own way.
You should always try and have an advocate with you, meaning a family member or a friend, somebody that will, because if you're getting bad news and you hear it, sometimes if it's really bad, you're not able to understand what is going on with you.
Communication is the key for healthcare professionals and consumers alike.
Acknowledge that doctors are smart, but they're not on a pedestal. They themselves don't. The good doctors today don't think of them on the pedestal.
There are subspecialties in medicine that I wasn't even exposed to in medical school, so there's no way I would expect my mother to know what she should do. So you need to have a medical home. And finding a medical home has a lot more to do with your personality in terms of the success of that medical home and the personality of your provider than a lot of times, fortunately, on our capabilities. The question is, can you talk to your doc? Can you relate to your doc? Are you comfortable having a relationship?
And once you've found that guide, don't stop asking
why. Ask why. Doctor makes a recommendation for something. Why?